I'm Greta McKelvey, Director of Compliance and Clinical Services here at Grant Regional Health Center. I've been here for about 3 years, so came in the middle of the project, but very blessed to be a part of this team. We have worked diligently on the construction here. One of the things I want to say is how important this hospital and this construction project has been to the community and for our whole region to provide that health care and the services that we need so we can grow and keep health care here locally for our region. We have still things to come, and I'll let Dawn talk about more of the construction piece, but it's been a great project to be involved in, and lots of good things to come and growth to come here for our area and serving our community.
And I'm Rochelle Williams, Marketing Director here at Grant Regional, and I would just like to invite everyone to attend our open house on Sunday, October 14th from 1 to 4. It'll be a great chance for people to come out and really see the expansion and all the new areas and the new services that we have to offer. Again, that's Sunday, October 14th from 1 to 4.
So Dave Smith, President and CEO, and I've really been blessed. I've been here a month, and these 4 individuals in front of you have kept everything together, not only through the project itself, but helping patients find their way through the maze, which you'll get a chance to see on the inside, and have kept the organization running strong and moving very well. So I'm very proud of these 4 and proud of the new facility itself.
I'm Stacy Martin, Director of Human Resources, and I've been here for 8 years, so was excited to be part of the project from the start to current day, and very excited to offer a state-of-the-art workplace for our staff here at Grant Regional.
Dawn Bandy, Chief Financial Officer here at Grant. I've been here for about 5 years with the project from the very beginning. We look like we're finished, but we're not quite finished. We've gone into the internal parts of the renovation of our project. So the operating room and the ED are finishing. So even though the main street is done, we still have about 12 weeks before we're completely done. So we're hoping by Thanksgiving that our project will wrap up and we'll be at the punch list phase, but not completely done. But we're very excited.
What of the parts of the project are complete now that people might notice changes?
So for the person or the patient walking in, Main Street is done, the med-surg unit is completed, the rural health clinic is done, outpatient department is done. So the last piece is the OR, which is not really seen because it's on the back street or the back now hallway, and the ED. So patients might feel it when they're taken back into the ED as they see the ICRO walls are called as the construction is behind there.
Okay. And then in terms of the scope of this project, I mean, can you talk a little bit about, what I guess what features have been added to the hospital and changes as a result of the new wing and renovation?
Sure. Rochelle, you can help
Yeah.
me with this.
Rochelle.
Rochelle is like, this is her area.
I can name the top 2 off the top of my head. One of the biggest highlights that we've been excited to add is an in-house MRI, and then also a rooftop heliport. If you point it right up there is where the helicopter lands now, so we're excited to have those 2 new features. But in addition to what Dawn said, our med-surg unit, our new clinic space is wonderful, beautiful, and expanded. Just a new space behind us. You can see the Main Street area. We've added a coffee shop and an expanded gift shop area. But some of our diagnostic units are just state-of-the-art, new areas, radiology, lab, outpatient, so we're very proud of all of those areas.
And when do you anticipate the whole entire project to be wrapped up?
We're saying at the end of the year, so I think that's kind of where we're on target for.
It'd be a great Christmas gift for everybody in the community.
That's right.
To have all this wrapped up by then.
And additional parking. If you kind of scan this area, we're very pleased to have much more parking for our patients and visitors as well.
I guess, is there anything else that any of you wanted to add? Or
I think also it's the staff that really make up our organization. Even though we have a wonderful new building, we just want to speak to the importance of our staff and how they've been really resilient through this whole process. It hasn't always been easy for this expansion to happen on site, and we just want to send out a big thank you to everyone that's worked hard to get get us to where we are today.
Took the words right out of my mouth.
And just one more point, we remain and have been for some time a 5-star hospital with Medicare, and that's in patient satisfaction, so we're very proud of that. That is something that doesn't go to that many hospitals even in the nation. So we're very, very proud of that. That maintained through this construction project. As you might know, patients have kind of been, we've worked really hard to keep their flow going and things like that. So we're so proud of that as we continue through the project and into the future, remaining that 5-star hospital. It's a lot to be proud of.